Patients want to know what to expect after a SmartLipo procedure in my office. So obviously it's going to vary from person to person, so these are general rules and there's always be an exception, and I'm always happy to hear from my patients. But basically I give most of my patients some oral sedation, something like Ativan. So the first thing you're going to notice when you get home is you're going to be sleepy, and it's very common to take a nap. As you've been told before, you have to have a driver, you can't take Uber, but expect to take a nap for a couple of hours, and you shouldn't drive until the next day and just relax at home. Next thing that can happen is it's very normal to leak a little bit of fluid. I put a lot of fluid in, I suck out some of the fluid, but some of it remains. So it's very common to leak some fluid. Sometimes it'll be a little blood tinge, sometimes you'll only leak from one incision, sometimes you won't leak at all. Those are all completely normal reactions. What about soreness? I've given everybody painkillers, so if you're sore, of course, take the painkillers, that's what they're for. And if you're not very sore, then you probably won't need them. So everybody's different. So if you need the painkillers, take them. If it's just a mild discomfort, you can take Tylenol. When you're on Celebrex, though, you can't take Motrin, Advil, Aleve, ibuprofen, because they're the same class of drugs. If you take the narco, which is of course a narcotic, it's important to take it with food so it doesn't upset your stomach. So again, that's going to vary from person to person. Bruising, some people will bruise, some people won't bruise. They're both normal. It doesn't mean you'll get a better or worse result. Typically it takes about 3 or 4 or 5 days before a bruise appears, and it will last generally around 2 or 3 weeks. I don't think there's a whole lot you can do to get rid of the bruise once you have it. Some people feel arnica is helpful, and we sell a combination to help prevent bruising. Sometimes you can buy some bromelain at the health food store that may make it dissolve quicker. What about the garment? I like most of my patients to wear a garment at least 5 days. Some patients have decreased skin tone, and I'll have you wear the garment longer. What about scarring? Scars are very tiny from SmartLipo. They're only a couple of millimeters. We sell a scar guard, but for most people, you really don't need to do anything. Some patients will ask me, can I put vitamin E or put something else on? I think it's fine. Those scars are usually going to be very inconspicuous. If your skin type is darker, sometimes you'll hyperpigment those scars, and I really have no control over that. That's really your body's reaction. But in general, if you give it time, most scars will get better and better with time. So those are really the commonest questions I get asked. One last thing I just remembered. Sometimes people will get areas of thickening or firmness where I've done the SmartLipo. That's not uncommon at all. So it's not that you can visually see something, but you might be able to feel some lumpiness or firmness inside the area I've done, particularly the abdomen or the love handles. That will improve with time. How much time are we talking about? We're talking about months, rarely 6 months. I've even seen a few patients take a year before it got completely soft, but most of the time it'll soften much sooner than that. I think massaging an area helps speed up the healing and any unevenness, so you can do that. Occasionally patients will get a professional lymphatic massage. There's certainly nothing wrong with that, but they can just massage it themselves. So those are really the commonest things to expect after SmartLipo. And as I said at the beginning of this, please don't hesitate to call my office. We're always happy to hear from you. If you've had a procedure with me, I've given you my cell phone number. Don't be shy about texting me with any questions you have. Thank you very much for your time.